Hi everyone, Dr. Khorasani here. Today I'm going to show you how I use fat transfer to correct a contour deformity caused by another surgeon during liposuction. First step is to create our port size, aka entry size. These ports will be used for our cannulas. The first cannula you see is infiltration of tumescent fluid to numb the area. Then we're going to use the same port to suction. The preferred area for suctions are usually either abdomen, or we can also use thighs as this case. The next step is we have to wash our fat. This is a closed system in order to prevent any microorganism to getting transferred into the system. The next step is to remove any excess amount of saline from our canister. And once that's done, we're going to do one extra wash, and that's done with an extra bag of clean saline to just do another wash. Then the fat is extracted from the bottom. Here we're going to spin the fat in 20 cc and 10 cc syringes. They're all capped. We're going to spin them at 3 minutes and 1000 RPM. Then the top layer, which is the supernatant, is discarded. Our fat is then transferred to 3 cc syringes via a sizer, and the first sizer is 2.4 millimeter. And once we have transferred them to 3 cc syringes, we're going to actually size them with the 1.4 millimeter and 1.2 millimeter sizers. And this is our workhorse fat, which is the microfat. We're also going to need a little bit of a nano fat, and the nano fat is purified here in this device that makes our nano fat. The next step is I'm using the high definition ultrasound to look for the vasculature and the anatomy, ensuring that the cannula is not going anywhere near there. Now the first step is injection of microfat. This is done with the 18 gauge cannula. And the level of this injection is a bit deeper. Again, this is an area that was over-suctioned by another surgeon, and we just getting this purified, refined fat back to this area with the 18 gauge cannula. This is sort of majority of the fat. Now, this patient also had a little bit of a dermal atrophy. So for doing that, now this is where we're going to use our nanofat. We have lots of growth factors in nanofat, and this is purified. And because of that, we can use actually a 25 gauge needle to inject this pretty superficially. And this will help us also build a bit of collagen and help us hopefully thicken her dermis as well. So microfat, deeper layer, and nanofat more superficially. And here are our patient's 3 months results showing complete correction of the contour deformity. Thank you for watching. This is Dr. Khorasani.